I am Dr. Philip Villiotte. I'm a radiation oncologist with Spectrum Medical Group, and I am the medical director here at the Cancer Care Center of York County. My father was a physician who did some cancer treatment as a radiologist back in the 70s, and I had some exposure to radiation therapy through him. And when I went to medical school, I found that I was interested in oncology and cancer treatment, and radiation oncology combines my interest in science and my interest in cancer care and the radiation therapy. Well, the most dramatic changes that I've witnessed from my father's time until now are advances in technology as far as the treatment, and advances in imaging and diagnosis and understanding the disease processes. And we can use the advances in technology and the advances in diagnosis to do a much better job of designing treatment and delivering quality care for patients. We can do a lot more for patients and be more successful taking care of them than we could when my father was practicing. We offer state-of-the-art care with image-guided radiotherapy and intensity-modulated radiation therapy. And in 2013, the Cancer Care Center of York County received accreditation from the American College of Radiology. This accreditation is very important to us as it recognizes formally our dedication to excellent patient care. Not every hospital in Maine has an accreditation through the American College of Radiology. All of our sites are now accredited, and we feel that it's a very important part of excellent patient care. The physicians at the Cancer Care Center of York County have a very collaborative approach to treating cancer patients. We work intimately with our colleagues in Spectrum Medical Group, with the physicians from Maine Center for Cancer Medicine, with local primary care physicians, with cancer surgeons, with the pathologists, the radiologists, and the whole team of affiliated providers such as nurse practitioners, social workers, genetic counselors, nutritionists, physical therapists, anyone who can provide part of our patients' care. And each day, as I see patients and work with them, I'm in contact with their other providers, either by phone or sometimes by email, and certainly by written communication, to make sure that everybody is up to date with the patient's care and that we can collaborate as a team to provide people the best possible care and treatment. When patients come to the Cancer Care Center of York County, they can expect an initial consultation with their physician and other providers. We will meet with the patient and their family. We will go over their diagnosis and care to date, and we will work with them to come up with a number of options for treatment, and then we will work to provide them with the best possible treatment plan. We offer a number of complementary therapies to our patients, such as yoga and Reiki therapy and massage therapy. Our Director, Karen Pierce-Stewart, has worked hard to make the Cancer Care Center of York County a place where we can offer more than just medical therapy. We can offer education and support and complementary therapies that we think are helpful and important to a person's care and their well-being. As medical director, my perspective on patient care has changed over time. I've become aware that there's a lot more to taking care of patients than just delivering their treatment. We have to take into account economics and insurance and all of the rest of a patient's life. There are issues of scheduling and education and complementary therapies that we strive to provide and demand and are worthy of a lot of our attention and effort. We work hard with insurance companies to make sure that the care is covered and paid for as much as possible. We strive to decrease the financial burden on patients. We strive to provide them with additional care and support and therapy. We try to do anything we can to make their treatment experience as good as possible and to provide them the most comprehensive care that we can. I find this job rewarding because you meet a number of wonderful patients. They may have a difficult situation or a difficult illness, but I found that it really brings out the best in people and their families, and we have a wonderful staff here at the Cancer Care Center of York County, and it is truly a pleasure and an honor to work with them and to be able to help take care of patients and provide the best care that we can for them. And I have found that the interaction with patients and their families and the collaboration with our colleagues and the staff to be a very rewarding experience across the board. It's wonderful to feel like you can help somebody with a problem such as pain, or to provide them some comfort or relief as they deal with their cancer. And it certainly is gratifying when you can cure patients of their cancer. Even if you can't cure people, hopefully we can help them and improve their quality of life. And I do find that very rewarding and gratifying. It's always nice to be able to help somebody when they have a need here in Sanford.